We are talking about genetics versus environment. What is more powerful in your long-term health and physique destiny? I talked about Eddie Murphy's movie, Trading Places, in the last introductory video, as it really made light of what is more powerful, genetics or hereditary in their case, which we will use the word environment for that. I want to talk about first disease states and then get into physiques. Because, again, with my job, I see people all the time that blame their disease states on mom and dad. I also see people all the time that blame their bellies or their butts or their lack of biceps on their mom and dad. So I tried to cover that in this little video series. Believe it or not, only about 5% of cardiovascular disease and cancers can be related directly genetically. In other words, 95% of cardiovascular disease and and cancers are controlled or influenced by the environment. If you remember this lovely young lady on the screen here who had this genetic predisposition, albeit small, to breast cancer. So she went out and had a radical surgery done, and it really influenced a number of women across the country to do the same. Personally, my opinion, I think that's very sad, because if the big and full picture was understood, that was an unnecessary thing. Now, genetics do help all of us in medicine as diagnosticians, I could say the word, to help diagnose things. For example, I use something called an ApoE genotype to help me decide what a person's cardiovascular risk is, what their future risk of Alzheimer's disease is, and how do we utilize our intervention based on those genetic chances or predispositions, not determinants, but predispositions, to help this person deal with this. I can tell you this, doing these tests, and I've done these tests for years and have thousands of people's data on it, I have many people with the ApoE genotype with the very bad alleles. They should have had Alzheimer's disease, they should have had heart disease a long time ago. Yet they're in their 80s and as healthy as can be. On the other side of the coin, I have people, young people. I'm thinking of one right now I just saw a few weeks ago. He's 31. He has the good genetics for heart disease, yet he's already suffered his first heart attack. So it's not just genetics, is it? It's environment. I like to think of genetics as a light switch with a dimmer on it. And what I mean by that, you may have a genetic predisposition toward disease state or toward a certain physique, but it requires the environment to flip that light switch on. And then based on that environmental exposure, which are a lot of variables which we'll cover in the next video, the dimmer goes up and down. That's really what genetic predisposition means. You may have the light switch, but you control the light switch with your environment, and then there's a dimmer on top of that. So in our next video, we'll get into more discussion about the many different factors that control the genetics, in other words, that environmental influence. And then as we go on, I'm going to give you some examples and show you some actual genetic studies on people and show you really what is more powerful, the environment or mom and dad's influence.